Welcome back to part 2 of chapter 24 lecture for ALH4. We left off talking about aging and falls, so this is where I'm going to start. So there is a greater risk of falling due to sensory motor changes in vision and mobility, osteoporosis, and cerebrovascular accidents. Usually, these falls result in fractures because of a large percentage of the elderly do have osteoporosis. Debilitating complications like decubitus ulcers, pneumonia, and the need for long-term care and even death can occur after falls. And falls cause the greatest number of injuries in people over the age of 70. Some ways that we can help to prevent falls. If the elderly patient has regular hearing and vision tests, understand the side effects of medication, especially those that cause vertigo. So again, that's something that falls back on us as medical assistants to make sure that they do understand their side effects and we do our patient education. If the patient experiences orthostatic hypotension, make sure that they rise slowly and stand still for a moment. Limit alcohol use. If needed, consistently use assistive devices such as a cane or walker. They can wear low-heeled, rubber-soled shoes and avoid going outside if the weather is icy and slick. They can engage in regular weight-bearing exercises for muscle and bone strength. Make sure to educate them on keeping the hallways, stairs, and bathrooms well lit, and also rugs and different things that might cause them to slip and fall, that they are either secured down or they are no longer in the area. And it's always important to assess the home for possible danger areas, such as slick surfaces on the floor or those rugs I was just talking about, etc. You can play an active role in helping family members and patients with this fall prevention because you are the patient educator. Make sure to recommend that the patients remove the throw rugs and that they use handrails on the steps and grab bars in the bathroom. And also, they should keep emergency numbers handy. And I don't know if you've seen, but help, I've fallen and I can't get up. There are services where they can actually wear just the monitor where they can hit the button if they have fallen and receive immediate emergency attention. So now we're going on to the disease and disorders faced by older patients and the medical assistant's role in the care of the aging patient. So we need to be able to do the following related to the nervous system, pulmonary system, sensory organs, urinary system, and reproductive systems. You should be able to explain the changes in the anatomy and physiology caused by aging, summarize the major related diseases and disorders faced by older patients, describe various screening tools for dementia, depression, and malnutrition in aging adults, and explain the effect of aging on sleep, as well as differentiate among independent, assisted, and skilled nursing facilities, summarize the role of the medical assistant in caring for an aging patient, determine the principles of effective communication with older patients, and discuss patient education as well as the legal and ethical issues associated with aging patients. So let's look now at the aging effects on the nervous system. The brain begins to get smaller at approximately age 50 and continues to do so as we age. Transmitting messages from one neuron to the next becomes more difficult, and I have told you this in class. I am definitely experiencing that, and I'm not quite 50. Older neurons process information more slowly, so that means that the reaction time also slows. Dementia is not an inevitable part of aging, but the result of an organic disorder. Recent research shows that the loss of brain cells is minimal and that the older brain is still capable of generating new neurons. So yay, that gives me hope. Many conditions can cause signs and symptoms of dementia, including depression, reaction to prescription and over-the-counter drugs, alcoholism, malnutrition, thyroid, liver, heart, and vascular disorders, as well as Parkinson's disease. Ways to maintain mental function. So exercise we know improves memory and thinking because it increases the oxygen to the brain. It's important for our elderly patients to keep socially active because they're utilizing their brain. Practice stress reduction activities. Definitely encourage them to quit smoking. Make sure to educate them on what it looks like to drink alcohol in moderation. Use hearing aids and glasses if needed, and make sure that they are encouraged to get treatment for their health issues. The best way to ensure mental functioning in later life is to remain mentally and physically stimulated. That's why we say make sure you continue to exercise and keep social activity. Screening tool for dementia. So mini mental state examination. This is a 5-minute test designed to evaluate basic mental functions in a number of different areas. It assesses the patient's ability to recall facts, write, and calculate numbers, and it gives the physician a quick way to determine whether a more in-depth testing panel is needed. You can look at figure 24.2 for an example of this test in your book, and you may, as a medical assistant, be expected to administer this examination, and that would be in your scope of practice with training, of course. Alzheimer's disease, abbreviated AD. It's a progressive deterioration of the brain caused by the destruction of the central nervous system, neurons. Leads to problems with memory, language, thinking, and behavior, and it's caused by buildup of the amyloid plaques and neurofibrillary tangles in the brain. It's important to note that Alzheimer's disease has no definitive diagnostic test because it can be confirmed only through examination of the brain at the time of autopsy. Signs and symptoms of AD: repeatedly asking the same question, inability to remember common words or mixing up words when describing something, inability to complete simple tasks and misplacing items, becoming lost when driving familiar routes, sudden mood swings for no apparent reason, and difficulty following simple directions. The course the disease takes and how fast changes occur varies among individuals, but on an average, patients live for about 8 to 10 years after they are diagnosed, and there is currently no treatment that can stop the progression of this disease. So some treatment options. The goals of treatment is to maintain normal activities as long as possible. Cholinesterase inhibitors may be prescribed to improve the production of the neurotransmitters in the brain, and medications may be prescribed to help control sleeplessness, agitation, wandering, anxiety, and depression. Supportive care for family members is absolutely essential here because they are faced with caring for a loved one who is experiencing a progressive memory loss, and you can be especially helpful in recommending educational workshops, support groups, and stress management skills for these caregivers. Aging effects on pulmonary systems. So maximum lung function decreases with age, and the lungs lose elasticity because of changes in the elastin and the collagen, and they become smaller and flabbier. The alveoli enlarge and walls become thinner, and the number of capillaries is reduced. Respiratory muscles weaken, and the chest walls may stiffen. The larynx also changes, so the voice typically gets quieter and slightly hoarse. What do you think causes the chest wall to stiffen? Well, the chest wall may stiffen from osteoporosis of the ribs and vertebrae and calcification of the costal cartilages. Pulmonary function tests reveal a decrease in vital capacity and an increase in residual volume. Let's look at vision. So by age 50, structural and functional changes in the eye become noticeable. The cornea increases in thickness and has reduced refractive power. The lens becomes flatter, thicker, less elastic, and more opaque. and reduction in size of pupil occurs. This limits the amount of light available to reach the retina, and there is a decreased tear production, which causes irritation and excessive tearing. The skin around the eyelids wrinkle, and the loss of the orbital fat allows the eyes to sink deeper into the orbit. Presbyopia develops in the 40s, making it hard to see up close. Ability to refocus from far to near decreases, and decreased ability to see some colors, which affects depth perception, occurs. Increased sensitivity to glare and decreased response to going from light to dark or dark to light occur as well. What causes the ability to see colors to change as one ages? So this is the yellowing of the lens that causes it to act like a filter, and it makes it difficult to distinguish certain color intensities. So blues, greens, and violets are hard to differentiate, whereas yellows, reds, and oranges are easier to identify. Glare is probably one of the most painful experiences for the aging eye because it does not know how to focus and filter that out. Cataracts, glaucoma, and macular degeneration. So cataracts are cloudy or opaque areas in the lens that cause a blurring of vision. Glaucoma is a result of blockage of outflow of the aqueous humor, which causes an increase in the intraocular pressure and damage to the optic nerve. And macular degeneration causes progressive loss of the central field of vision. So here are some suggestions for helping visually impaired older adults. Allow the patient to place the hand above your elbow to follow your movements and feel secure. Use high levels of even glare-free light. Ask pharmacists to use a large lettering on medication bottles. Use non-glare paper and large print forms for educational materials. Make distinct differences for pills that are similar in size and color, and place all objects within the visual field, and make sure to prevent clutter. Now look at hearing and the aging effects. Lack of attention when addressed, inappropriate responses, asking to have statements repeated, and speaking too loudly or too softly often are signs of hearing loss. Hearing loss can have a profound psychological effect on aging people. It can cause depression, social withdrawals, and feelings of isolation. Presbycusis is associated with normal aging and causes a decreased ability to hear high frequencies and to be able to discriminate sounds. And tinnitus is a ringing or buzzing in the ear. Hearing impairments are compounded by the impacted cerumen, otitis media, otosclerosis, and long-term exposure to intense noise. And also certain ototoxic drugs such as aspirin can affect hearing. Hearing loss with its resultant isolation is directly related to the development of depression in older adults. So here's the Geriatric Depression Scale. It's a screening tool for depression. It includes questions for the patient about daily activities, interests, and feelings to help diagnose depression in the ambulatory setting. You can refer to figure 24.3 for the short form of this depression scale. And the medical assistant may be able to contribute to information about depression in elderly patients through conversations with the individual and with the family members. Here are some ways to help an older adult who is hearing impaired. Stand in patient's direct line of vision and gently touch the person to get his or her attention. Use gestures, pictures, and large, bold print to communicate. Talk in short sentences into the ear with the better hearing. Do not increase the volume of your speech. This also raises the frequency